Hey guys, this is Grace, and my topic is a prevention of central line associated infections. A central line is a central venous access device that is placed in one of the major veins, close proximity to the heart. It directly accesses the bloodstream. The most common sites would be the internal jugular in the neck, the subclavian near the clavicle, and the femoral vein in the groin. These are inserted sterilely by a qualified medical provider, and the dressing changes are also done sterilely by a nurse. These can be used for medication administration, fluids, blood draws, some other medical procedures, and these are kept in long term from anywhere from weeks to months. A central line associated infection is a serious infection where pathogens enter the bloodstream directly from access through the central line. They would present with fever, redness at the site, warmth, swelling, pain, purulent drainage at the site. These are preventable, and we can prevent those increased hospital stays, healthcare costs, and mortality rates. Prevention, so we can prevent this. The number one way is hand hygiene. We need to make sure that the provider is using strict sterile technique when inserting. Using chlorhexidine skin prep prior to insertion can decrease infection. Making sure they choose the proper site is going to be important. The femoral site should be saved for last because of unsanitary reasons in the groin area. We need to make sure the dressing is staying clean, dry, and intact, and if it's not, we need to change it sterilely. We need to make sure we're cleaning the hubs and the ports prior to using them, and make sure we're assessing every day for the need for the central line. If it's not needed anymore, we need to discontinue it as soon as possible. My evidence-based article, there was an article about a hospital who implemented a Stop CLASB project. The project adopted a CLASB prevention intervention bundle and the filling out of CLASB audit forms for every central line patient at the facility every shift. The CLASB prevention intervention bundle was made up of hand hygiene, sterile insertion, sterile care, chlorhexidine skin prep, tubing changes, scrub the hub, and prompt catheter discontinuation. If these were all done together, would decrease the risk of the central line infections. They also included filling out these central line audit forms to hold the staff accountable for implementing this intervention bundle, and held them accountable for frequent assessments of the site. And doing all of these things together decreased the risk of central line infections. BSN essentials. So I chose quality and safety. Nurses caring for patients with central lines must incorporate both quality and safety in their care to prevent central line associated infections and increasing optimal outcomes for the patient. Nurses should practice safety by implementing infection prevention strategies like hand hygiene, sterile dressing changes, frequent assessment of the site, and so on. I also chose to connect it to interprofessional partnerships because it takes effective collaboration, communication, and advocacy between the nurses, the providers, the patient, and the family. This is all going to be important for optimal patient outcomes with the central line. Nurses should communicate any signs of central line infection to the proper healthcare provider in a professional and time-effective manner so that rigorous treatment can be done to provide and improve patient outcomes by treating the infection. Nurses can also assist the healthcare provider during the insertion procedure. We can serve as an advocate if we witness the provider break sterile technique. We can potentially save the patient from a severe infection if we intervene and hold the doctor accountable for maintaining sterility. QZIN. So I chose to connect it to quality improvement. The nurses can work together to test and implement interventional strategies to decrease the risk of central line associated infections. It's also going to be a continuing process of adapting new infection prevention strategies. This can continuously decrease the risk of infection. Evidence-based practice is another way I connected QZIN. So nurses can use evidence-based practice articles and research to gain the best current evidence and expertise to implement into their practice to ensure optimal outcomes for their patients with central lines. Evidence-based practice is beneficial to implement into patient care because the results have been thoroughly tested using scientific method-based methods, much like the hospital who implemented the CLASB prevention project with the bundle of interventions to prevent infection and the audit forms, filling out the audit forms. And my references are right here. I used the American Association of Colleges of Nurses. I used a article about central line associated bloodstream infections. I used the textbook Cherry and Jacob, and I used another evidence-based article about the bundle approach to prevent central line associated infections. And that's it.